a independent agent, and I am licensed in Florida, New York, and New Jersey to help anyone 65 and older or anyone that is disabled at a younger age or end-stage retinal disease to help them with understanding Medicare. There are different parts of it, so I do a lot of educational training so everyone can understand what are the differences and how it affects you as we age into being 65 and older. Yes. So, how many of you have heard about this that is coming into play starting January 1st, 2024? 25, yes, 25. Okay, what is it, sir? What's your name? Alan, what do you know of it? Correct. It's exactly what he says. It's about the $2,000 maximum now that anyone has to pay for their prescription. There was a time that it was higher, and we're going to go through this. So write your questions down, and we will just continue to answer. So today, I'll go quickly through some of these because you guys already know some of these already. No need for me to keep going over and over with it. So everyone knows what's Medicare, right? We all know. I don't need to go through this process with anyone in this room at this moment. The next. Everyone understand these terms: premium, copay, deductible, co-insurance. Which do you prefer? Do you prefer copay or co-insurance? Very good. Okay. Anyone knows the difference yet before I answer? Okay. No. Copay is a fixed amount you pay at the time of a doctor's visit. So the copay is $25, $35. But the co-insurance is a percentage of your bill. So when you see a doctor and they say today is $35 co-pay, you know you're only paying $35. But when it's a co-insurance on your plan, then if the bill is $1,000 and you have to pay 20% of that, then how much are you paying? There you go. So would you rather pay $200 or $25? So based on your plan, you need to have a look at it and see what are you going to be paying when you go to see the doctor or when you go for a prescription. And again, we're going to go through some of that so you understand. Okay, we all know about original Medicare, Part A, Part B. If I'm skipping, stop me, but I'm not going to go over things that you guys already know. We all know what Part A cover, yes? Hospital, skill, hospice, home health care. And the cost is zero premium for these, okay? Does everyone have Medicare in the United States? Okay, what are the requirements to have Medicare? Age is one. Your citizenship, Social Security, but how do you get Social Security? How many hours? How many credits? 40, right? So up to 10 years. Am I good this way in the back? Okay. Oh, okay, okay. So, And if you're permanent resident of the United States, you're also qualified. Okay? Now, do you have to be entitled to Part A and enroll in Part B to get Medicare? Yes. Right. You're entitled to Part A and enroll in Part B. Now, how many of you know what is your cost for Part B next year if you don't have high income? Yes. Well, that it comes out of your Social Security check. We went through this already. Remember, we're not going to spend times on things that you guys know. Age, a U.S. citizen, legal resident for at least 5 years. This doesn't apply to you guys, so we're going to, move along. And people that are also eligible for this can choose different kind of care. Now, let's go through this. This position is good? Okay, perfect. The number one is all of you should have a red, white, and blue card. If you only have that and see a doctor, you must also have a drug that's attached to it. Number one, you're responsible for 20% of all bills. That is called original Medicare. There are some people that have original Medicare. Original Medicare allows you to see any doctor in the United States that takes Medicare. Any doctor. The next is original Medicare, a supplement plan, and a drug plan. Some of you here has a supplement plan that goes with your original and your drugs. The supplement plan runs anywhere from $200 to $300-$400 a month. And you can see any doctor that takes Medicare. These plans, some of them have foreign travel benefits on these plans. However, many of the Americans do have a Medicare Advantage plan. The Advantage plan has Part D in it, and the restriction is you can only see doctors in the Medicare Advantage plan system. This year, they have come out with some plans that will allow you to see doctors anywhere in the United States. And if those doctors don't go to your carrier and bill them, you pay and you'll get the money back. That's one of the things that they are trying to implement, and they're doing it. Any questions? Now, the first plan, if you wanted to see a doctor, a dental, or an eye vision doctor, you have to take another plan. The second plan, if you want dental and eye, you have to take another plan. The Advantage plan all has some dental and vision attached to those plans. Those plans has an HMO and a PPO plan. What's the difference with HMO and PPO? Okay. PPO, she said you can see whoever you wanted, but you have to make a monthly premium. No. The PPO plans can have a premium, but many of them is still zero premium. However, you're allowed to see any doctor that takes that plan without a referral. That's the key. So if you would like to see, what's your name, hon? Roz. Well, Roz, yeah, but we're doing. If you want to see Roz in Miami, because she's well renowned, she's the best. Everyone talks about her. People are flying in, sailing in to see her. And her office says, we will build your insurance company. Great, if you're on this particular plan. But if her office says, no, we won't, okay, I'll pay. And she gives me a receipt. I take that receipt, and then I submit it to my plan, and you'll get reimbursed. So now this year, they do have what is called a passive plan, and anyone that's interested in that, they can do that. My recommendation to many people is the moment you are out of the United States, because remember, in an emergency situation and you go to the hospital, your red, white, and blue card takes care of it. However, if you're not feeling well and you're just going to see a doctor, they're recommending now for you to go to an urgent care. So when you travel, always find out where a doctor is in the area that you're going to that will take your plan and the closest urgent care to where you're going. So this way, you can give it to your loved one. So they have it. So if something happens, they know the hospitals that are in network. They'll also know the doctor in network and the urgent care in network that you can go to see. Any question on this so far? Good? Excellent. I love you guys. Yesterday I had it in Delray Beach, and many people were surprised at some of these. Okay, now, these we talked about. For the first one, you have to obtain a standalone PDP plan. If you have Medicare and you do not have a credible drug plan, there is a penalty. Everyone in this room, I don't have to concern myself with, because you obviously have Medicare and you have a drug plan. So we don't need to labor this. Only people that are turning 65 that I have to go through explaining this more thoroughly. But you guys already covered there. We're getting to the meat of what's going to affect you. Okay, so we have over 14 million Americans and Medicare supplement plan. This particular year, because some of the plans are they're terminating some of your plans. This is why it's imperative for you to go home again and look for that information that they mail to you about your plan. If you're on a supplement plan, you will not have received it. Only people on a Medicare Advantage plan receive that at the end of September. The Center of Medicare Services, by law, requires that all the carriers send that out to people that are Medicare Advantage plan. How many people do you think are on Medicare Advantage plan? If 14 million are on Medicare supplement, what is the data? Well, 28 million is on Medicare Advantage plan. So you have over 28 plus 14 gives you what? There you go. Over 42 million people in the United States are on a Medicare plan. But most of the people are on the Medicare Advantage plan. Any question? Any? Advantage, yes. The care supplement, yes. And the reason is, many people, when you turn 65, regardless of your chronic condition, you can automatically get the supplement plan. And many people wanted the ability to see any doctor in the United States that takes Medicare, not doctors that only take a specific plan. And it costs money. Because as you see, most plans are from, they have A, B, C, D, E. We just put the most common one is G, N, and F. These are all different plans sold by private insurance. So there's a cost, $200, $300, $400, $500 a month. Plus you have to pay for Part D, a drug plan. Plus if you need dental, you have to pay for a plan. Plus if you need vision, you have to pay for a plan. So most people opt out of that. Or most people are on fixed income, we're living longer, their financing is not keeping up with that sort of expense, so they'll switch to an Advantage plan. Okay, now we just basically talked about this, that over 32 million people are on the plans. I said 28, 32 over 32, and see what it covers. Part A, Part B, prescription drug. Most of them have a 0 premium, an annual out-of-pocket maximum. The Advantage plan has a maximum you'll ever pay out of pocket. When you're on the regular original plan, you pay 20% of whatever that cost is. And they have a network doctor, we talked about that, and it's sold by private carriers. You guys know in South Florida, which is where we are, the big ones, we all know the name. I can call those names because I'm not selling it to you today. It's Aetna, United, and Humana, and then they have Care Plus that is big in Miami. Those are the big boys, I call them, in this market. And someone yesterday asked me a question that they did not realize, that the plan in Palm Beach County is different from the plans in Broward County, and is different from the plan in Miami-Dade. So if you have a PPO here and you want to see a doctor there that takes that plan, one of those, you can see it. But if you have an HMO and you leave from Palm Beach to go over to Broward, and that plan doesn't in Broward, you cannot see that doctor. Okay? So be careful when you jump from county to county, and you're seeing your best friend and you're hanging out with your friends, only to find out that now I have to see a doctor, but I have to drive an hour back to Palm Beach. And Palm Beach County plans are rich in benefit, but the further south you go, there are a lot more benefits in those markets, believe it or not. A question? Yeah. Question? Yeah. Yeah, wow is right. There is an assumption from a geographical standpoint. If you think about the further south you get, who are more of the people that might need it? There's this assumption that in Palm Beach County, we can afford a little bit more. So instead of giving us some of these benefits, the benefits are given in other areas where they have strategically did their survey and realized that the needs are stronger. So here are all your plans, right? The MAPD, which is a plan that has prescription drugs attached to that. Most Advantage plan has that. Then you have a Part D, going to your question of the drugs. Some people have separate drugs plan because they have a supplement plan, so they have a drug plan. Some of those drug plans are canceling for 2025. Yes, so be prepared to look again at it. And again, I'm more than willing to answer anyone private questions. All you have to do is you have to schedule. The Center of Medicare Service requires that it's 48 hours from the time we book that I can speak to you about your plan. I can officially send you a summary of benefits of your plan. You can call me and I can send it to you. All right. And then, but if you want me to discuss it and help you through it, then we have to schedule within a 48 hours. Once it's scheduled, I don't have to reschedule it 48 because it's called a scope of appointment. It's valid for a year. Yes, sir, in the back. Yeah. It depends. Okay, so the drug plan has something to do with the formula. So it all depends on the medication that you're taking and where it fits into tier 1, tier 2, tier 3, tier 4. That determines the cost of your Part D plan. So yes, it all this what happened is people like myself, we have a list of all the medications that people can take in the United States. And you let me know, I put it in the system, it populates this information, and it says, based on your meds, this Part D plan, if you choose Aetna, United, whoever, it costs you this much per month. I've seen it goes from $50 to $100 a month. Now, the CSNP are people with chronic situation. They are plans if you have chronic situation. Believe it or not, there is a plan for anyone that have 3 drinks a week. And I remember when they said that, I go, well, I guess I'm qualified because I am definitely more than 3 drinks a day. So there is a chronic, sorry, a week. Oh, but I just gave myself away. When I go on a cruise, I'm having more than 3 a day. But there's a chronic plan for something like that. But chronic situation, back pain, those kinds of things, there's a specific plan for that. It's an HMO. They're all HMO plans managed through your primary care doctor. The MA plan, primarily I see people that are vets. Vets that are not TRICARE or CAMP VA, they can apply for a MA plan because they see doctors at the VA. So they qualify for that. The D-SNP is what it's called, is people that are receiving Medicaid and Medicare. They are people that qualifies for that, and there's a way to go through to see if you're qualified. I try to do it every year. Believe it or not, ladies and gentlemen, I do. Please tell me I don't look 65, but anyway. I try every year to see if I qualify for Medicaid and Medicare, and they keep saying, no, you're not qualified. But you should check. You never know when the loophole is there in your mind. 5-star. There are some plans that are 5-star, which means hospital rates them, you rate them, doctors rate them, and if you are in one of those, you can change any time during the year. You don't have to wait for enrollment period. So if you sign up now and you decide you want to go into one of the 5-star plans, you can change anytime into one of those plans. That's the beauty of those. And then we talked about the med sub. So you can see these are all the plans you can choose from. But many of you, I think, is on an MAPD plan and med sub. Everyone knows these are enrollment period, October, November, December. This is when you get all the calls and the mails and everything. And then in January, there is another time that if you didn't make a decision between October and November and you're on a Medicare Advantage plan, you still can make a change. So if you make the change in January, it becomes effective in February. To make the change in February, it becomes effective, but it's only one time you're allowed to do that if you're on a Medicare Advantage plan. This is one I just talked about, the January through March. If you're enrolled in a Medicare Advantage plan, you can switch to a different MA plan or disenroll, either or, between that period. Now, this is what we also talked about. These are the different sites that if anybody you know needs extra help, you go to SSA, which is socialsecurity.com. If you need some information in Medicare saving programs, what programs they have, you go to the benefit.gov. And for Medicaid is medicaid.gov. These are all the state programs that are available for anyone that believes that they needs it or qualified. In 2020, it was estimated that over how many people fill prescription drugs in the United States? A, B, C, or D? D. Yes. Yes. D. Yeah. And here are all the way you can get your drugs. Generic, different medication by authorized providers, different pharmacy, coupon saving, patient assistance service, or other plans. These are all the way to get your drug plan. Here is the Inflation Reduction Act that is affecting everyone in January. There are people that's going to go to their pharmacy and they're going to say, I only pay $50. Why is it costing me $200? Because these are the changes. The Inflation Reduction Act, it was signed in August, and the intent is to improve access to affordable treatment and provide financial release for millions. So with this, they came up with a prepaid system that if you go to the drugstore and the bill is $600 now and you can't afford it, they will bill it to your insurance and then you pay a monthly. You have to sign up for that and start to make monthly payment. So with that, the maximum that anyone will pay is $2,000. How many of you in this room know probably what percentage of people of all those 42 millions, right, that were paying over $8,500 in Part D in their drugs? What percentage do you really think was paying over $8,000 in for the the max? Because after that, they got into this donut hole, and then with the donut hole, then it went to a certain amount. But paying up to that much, because now they're changing it to $2,000 to max it out. How many people you think was paying the $8,500, $7,000 for their prescription drug before it maxed out? There are people who are paying $15,000 and $20,000. 8%. So think about what happened. Who do you think now is going to cover for that extra $6,000 that was being paid by someone else? We are. That's the changes. And you will see we talked about the gap. No need for me to repeat that. And you'll see some of the selective drugs that they negotiated. But these are not going to be in effect until 2026. But these are some of the, these are some of the drugs that they negotiated. So the new law requires drug company that raises their drug price faster than the rate of inflation, that's why it's the Inflation Act, to pay Medicare a rebate. This would lead to stronger Medicare for current and future enrollees and discourage unreasonable price increase by drug company. That's what the act is about. What may happen to your health plan? Lean out selective medical benefit to offset increased costs. So you will look at the plan if you don't have it, I'll send it to you. You will probably notice that some of your Part D plans that you were paying a fixed amount, it has now went to a percentage. So the pill was $100. Maybe now you have to pay $20 or $80 when your pills was $0. Some of us had medication that was $0. Now that medication might go to a percentage. Yes, one for. For those people that their medication was right. You got it. This is called business to them, isn't it? In the back. One sec. Oh, okay. Sorry. There's no more donut hole. The question really was, I'll summarize this, and if I have it wrong, please correct me. It has to do with the fact that in the past, there was this much that individual had to pay up to a certain amount. With this new Inflation Act, those people now are maxed out at $2,000. No more donut holes. So once they have paid $2,000 for their meds, it becomes $0. Therefore, people like us or anybody else that didn't have to pay X number of dollars, we may go to the pharmacy and our meds were $0. Now, depending on your formula and what they change is, you might now have to pay a percentage of that now. So the drug company is still going to make their money. Right, that is a part of it because the insulin now that we saw was $35. So yes, that is also a part of the mathematics behind it. Did I see another hand? You know, when I went to grad school, one of the things that they taught us, there are no free lunch. So you're going to give up something here and something else go here. Now, I personally, I am distraught because I do not appreciate a system that every October, elderly must read pages and pages of information to determine whether they should stay in a plan or move. I have to take an exam from the American Health Insurance every year for me to stand here and talk this. And the minimum score is 90. Minimum score is a 90. 3 attempts. And then after I study and pass that, every carrier that I am going to present to you, I have to take their certification exam. So when you see people like myself doing this, it's because we are knowledgeable because they're not passing you if you don't get a 90. So you have to at least know 90% of the information. The other 10% that we're going to screw up on, you might not even notice the difference. Now, some people have to pay their bills, right? And they come to seniors and they sell the seniors anything. And the poor seniors sign. I would love for you guys to see me in the supermarket and go, "Hi, Miss Walsh." So I try not to do that. But every January, look in the paper, you'll see how many people are in chain because it's called Medicare fraud. And they are constantly, the doctors, the pharmacists are constantly using us. So be careful this year, guy. Look at your plan, circle the area that is different than what you were paying last year. Think about whether you want to stay with it or you're going to go with another one, but please understand before you make any change. Okay? Oh, that okay. The part B she's asking about this year is going up to $174. All right, you just give yourself away. If it's based on your income, so the higher your income, the more you pay for part B. Yes, and it's a 2-year standards that they use. So in 2020, if your income was high and they're charging you 200 and something dollars, then 2022 they make the adjustment. 2022, if your income was high, it goes to 2024. So this January they make the adjustment. So the part B is definitely based on your income, guys. But the average person is 174 this year. Yes. It is based on your adjusted gross income and your tax return. That is correct. So on your 1040, the first page, they add all those things up. And then when you turn the back of the 1040, it comes out to your gross income after they take off the standard deduction, and that is what is used to determine the amount of money you pay for Social Security Part B benefits. Yes, you can go to Medicare.gov, just like you said, and you can sign in and put all your drugs in there. And yes, it will go through the formulas just came out, by the way. And then yet it will let you know which one is in tier 1, which one is tier 2, and give you an average cost per month that is going to cost you for your Part D. That is, did I answer your question? Or oh, oh, do I like that website? I don't have anything against the website. I am an agent. So we as agent has literally the ones that they gave us to do the same thing that you go home and do. The difference between me and you doing it, which is nothing, I mean, this is no secret, that if I sign you up with a plan, then that plan pay me a commission. But if I don't do anything and you call me within the 48 hours and I sit on the phone, which is what I like to do, because you guys heard what I said, I have a problem with the system not making sure people understand their plan. You call me, you gave it to me, I put it in, I send it off to you, you look at it, so you get to see. It's the same thing. So depending if you like to do the work or you have me do the work, I will, I don't have kids to take care of me, so I hope that this sounds okay. I'm hoping that if I keep doing this, God is going to keep a space for me and then send somebody, because at some point, ladies and gentlemen, I am not going to be able to pass that exam. My brain is not going to be able to do so. I will be sitting here listening to someone bringing me up to date with the current. Yes, young lady. Nice. Yeah. Part D, maybe. Yes, she said that she's been dealing with an agent, and he apparently received a letter and saying that if right, correct, correct. So a lot of the plans, just like she said, in the Part D, they are no longer paying the agent a commission. So because of that, they are agents that basically doing what they did, and he or she's not going to do it. I just told you, is looking for a place that they point and go, that lady helped a lot of people. And so I am not going to not do that because I'm not going to make a commission. I'm not going to do that. I'm just not going to do that. You know, it's help. I can't do it. So yes, he is right that he won't, and because of that, many of them will not be signing people up because they're not going to make any money. Was there another question over here? Well, okay, so her question is that she said she got her Social Security statement and she saw something where there was a deduction for not only Part B, but Part D. So you, again, must have a supplement plan. Oh, God, I know my stuff. Yes, because you are authorizing them to take your payment out of your Social Security. And that is correct. You will see, you'll definitely see B and D from your Social Security. And the amount of money for Part B is based on your adjusted gross income. Our question is Part B, D. D has nothing to do with your adjusted gross income. That's just the cost that you pay to have your Part D drugs. So based on the formula, and each year it goes back in the system, it tells you what your new Part D drug cost is going to be. Now, but what's your name, young lady? What's your name? Paula. Based on what Paula just said, if your agent realize he or she is not going to get a commission, then bye-bye. Go find someone else to do your Part D is basically what that agent is saying. You know, I'm not getting a commission. I'm not going to do this. So go find someone else. And they are plans that are terming. So that's why it's important, again, guys, to look at that information. Each of you have a card if you are on a Medicare Advantage plan. On that card, and on your right to the bottom, somewhere on the top, it's a letter start with an H. That is your plan ID number. Again, you guys can give me a call, and I can send you your plan for this year to look at and walk you through step by step what it is going to cost you this year, okay? Any other question about, yeah? Okay, so does everyone know how that works? Because, say for instance, your husband was receiving $1,500 a month. Let's use it easy, $1,000 a month. And you were receiving $500 a month. The difference is you are only now going to receive $1,000 a month. Not your 5 and not that 1,000. It's 1,000 you will now receive. So 2 income was coming in, but you only receive the higher off the one that was coming in, and it all. I mean, sometimes it's bordering on $20 difference, and that's it. So if that's what you saw, it has to be a significant amount of money for you to see that different when he passed. Right, but now it's only for one. Yeah. Oh, well, then the only thing I can think of, which you need to verify with Social Security, I'm speculating maybe the information didn't get to them yet, but it's a year or whatever. Oh, okay. Yes. Okay, yeah. So, yes, it's definitely that deduction for Part B is strictly based on income. Strictly based on income. Yeah, okay. So, advice. This is an advice that I give all the time. When you're thinking about choosing a plan, even this year, guys, go through it, look at it. What's your budget? If you can afford to get a supplement plan and you have no chronic condition, do a supplement. Remember, you can see any doctor in the United States, and you have to pay for Part D. You have to pay dental. You have to pay eye vision. If you want to do that, then do it, because your preference is you want to see any doctor that takes Medicare in the United States. You want to get on a plane and go to famous Paula because she's well renowned. The next is your doctors. I have talked to people that go, I like my doctor. I don't want to change my doctor. Okay. But your doctor is not taking your plan this year. What are you going to do? What do you mean he's not taking he's not taking your plan this year? He's out. He's done with your plan. He's now on this plan. He says it's too much paperwork. He's not filling out these paperwork. So if you want that doctor, this is the plan. The next is your drug costs. When you put it in the system, it gives you what the monthly drug cost might be. So there are different plans based on what they negotiate with the pharmaceutical companies. The cost is different. So you put it in and you get to see what plan gives you a lower cost. The next is, how often do you go to the doctor? If you're going to go to the doctor all the time, an HMO plan works because many of them is 0 to see a doctor and 0 to see a specialist. A PPO plan, many of them maybe 0 to see your PCP, your primary care, but there's a cost to see a specialist. That's where the summary of benefit comes in that I talked to you about, that you go through it. I get you to circle. By the way, I was a professor, so I have this thing about I want people to have a book and circle as I talk, when they're on the phone. Do you have your book? You receive it? Okay, guys, write down, because it's on the computer, so now I want you to write down line 1, inpatient doctor, 0. Outpatient doctor, so you have an idea that when you go to see these doctors, what it's going to cost you. The other thing I say to people every year, use one credit card to see a doctor. And it's called the doctor credit card. So by the end of the year, you have a general idea what you pay to see doctors and your drug costs. So that gives you a good idea what is costing you to see a doctor, in this case, 2025, because you're all going to do that now, right? You're all going to go home and remember that I am not using this card for nothing else but to see doctors. And what are your likes and dislikes about the plan that you have? Your travel habits. Now, when you're leaving the country, guys, please, I know people say all the time, but it's costing me $800 or $1,000 in travel insurance. What do you rather do? I mean, get on a plane and go to another country, and now you want to be sent back to your home. You want to go to see a private doctor in these countries, because remember, many of these countries have public doctors, public hospitals, private doctors that work at a private hospital. If you have a travel insurance, you're going to go to a private doctor at a private hospital, not Diana public hospital. You understand? So it's best to do that. So these are the things that you need to do. We went through that with me, that I'm authorized, I'm trained, I'm certified in order to do this. I talked about that. If you guys want information about your summer of benefit, what I can do for you guys. Guys, again, let me repeat, this is on tape, I'm on video. I am not selling you anything, not changing your plans. I'm educating you to make the best decision for yourself. My service is to offer you that sort of thing. We already did that, and that's it. I'm available for any questions, and if anyone wants me to talk to them, I'll give you my number. You can call. I'll schedule one-on-one on the phone, nothing drama, nothing crazy. And, you know, we schedule it for within the CMS rules, Center Medicare Services 48, and just to help you to understand your plan. Now, I have a lady that says to me, her plan is terminating. So again, you guys don't know if your plan is terminating because you probably didn't open that thing that they mailed to you, but many plans are being termed if you're on a Medicare Advantage plan. So if you're on a Medicare Advantage plan and it's terminating, this is the one time that they're allowing you to also transition to a supplement plan if you want to. But you still have to go to the health check. But you can make changes, because if your plan is terminating, it means you have no plan. So you guys, please make sure that you at least verify. I have some kind of teary-eye thing going on here, and that your plan is effective. Now, I have a lady that says to me, my plan is terminating, and I care about transportation. And I also care about having my dental work done. I said to her, there are 3 plans that can help you. Well, I don't want that plan. Well, which plan do you want? I want this plan. All right. Well, this plan will not give you transportation, and this plan doesn't have the dental. You said you want a plan for these 2. So these are the things that you have to think about. Is getting 50 rides to see your doctor important to you? Because now there are cars that they'll give you to take a Uber or a Lyft or, you know, whatever, to take you to see your doctor. One-way trip, so one way is this way, come back is the other, and they offer you 50 trips a year. It's available. There are plans that some people will get up to $200 that they can use at Publix or the supermarket for gas or things like that. If those things are important, there are plans available out there. Many people are, I don't know anybody that's probably not diabetic. There are diabetic plans that is available. The thing with those plans, ladies and gentlemen, that many of them are HMO plans, and many people do not want HMO. So that is the key area. Then there are plans that will pay the $174 this year. So if you're even paying higher, you have a plan that will pay up to the $174 in your Part B. So you pay it and they reimburse you. Those plans, when you see a specialist, it's a bit higher. Do you understand? No free lunch. So they give you the $174, but if you're going to go see doctors every month, don't take it because you will have eaten it up anyway. So there are different plans out there that is for a lot of different things. Plans with up to $5,000 in dental work, not implants this year. But if you have a plan that have implants, make sure you see your doctor ASAP, because next year it will be gone. Yeah. Why is government program complicated and expensive? You know that if I could figure that system out around the world, what power I will have? I can't answer that because I tell you, I'm trying to fight that we do not have elderly people in their 90s have to deal with every October that they have to read a plan, which they're not reading. So now what happened is they go to the doctor, they have a card, and this happened, and the kid call and say, but da 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 da, and you go, but that's the plan they have, and now they say, but I don't have the money to pay this. Well, that's the plan your parent had. You understand? And this year, one of our requirement is that if I am speaking to you and I go through your plan and you said, repeat that again, my job is supposed to say, do you have someone else that you can have with you so I can explain the plan to them? Because all those commercials that you guys saw on TV, the elderly was calling those numbers. They were switching their plans on them. Then when they go to see the doctor, they were paying money and said, I never pay. And they go, well, this is your new card. They were complaining only to find out these people were calling the number on TV, and because they hear that they got free meals, remember, all of those things, and they wanted it, did not understand that the free meal is after you have stayed in a hospital. And when you leave the hospital, you'll get over 14 meals delivered to you. But you have to go in a hospital first. Yes, I do have a card. Okay. Any question, guys? I'm available. Thank you so much yes. Thank you, thank you, thank you.